Hello friends, Dr. Pranaya here. Today I am going to discuss about how to care for your nail. Everyone takes care of nail as a part of cosmetic concern. But nail is actually an important structure of your skin and it has protective function. Today I am going to discuss about how to cut your nail, how to clean them, how to moisturize and how to groom them. What are the nail conditions that are associated in skin problems? Comes first, how to cut the nail. When I say nail plate, that is what grows from the skin, comes out of your skin, and when it is overgrown, we cut it off. The rate of growth of nail is 0.1 mm per day. For the fingernails, it is around 6 months. For the toenails, it is around 9 months. So when you are keeping longer length, you have to understand that it should be manageable. Ideally, you should cut it short. I see a lot of people coming to me with ingrown nails, either on the fingernail or a toenail. Actually, ingrown nail happens because of not cutting your nails properly. So how to cut them? When you have a tendency of shaping your nail deep and down, touching your skin, you actually cause trauma to the nail and it starts growing onto your skin. You should ideally cut your nail in a square shape. You should not cut it in a round shape, or you should not cut it very close to the nail foot. That is how you can prevent further ingrowing. Next, commonly, how to clean. Lot of people prefer to do manicure and pedicure. That is good. But sometimes excessive trauma because of using the instruments during the parlor manicure and pedicure, you can even get chance of infection. So while cleaning at home, ideally you should use a basin. You can take warm water, dip your hands and feet into it for some time, cleanse it properly and apply a good moisturizer. Moisturization ideally should happen immediately after bath. Usually we ignore nail and nail fold, but after bath, as you moisturize your face and body areas, you should also moisturize the nail and the area around the nail plate. Before bed also, you can moisturize your hands and feet. As a part of that, you can moisturize your nails. Especially in people who are involved in a job wherein their hands are immersed in water all the time, or those who are athlete or those who have to wear shoes all the time, these people have to take care of their fingernails and toenails properly. The water retention and sweat retention is happening on your hand or feet. You tend to acquire infection in and around your nail. So those who are into a job wherein they have to immerse their hands into water or wash their hands frequently, they can either use gloves, or those who are using shoes all the time, they can shift changing it to some aerated shoes. Next is grooming the nails. All the females have the habit of doing the nail polish or nail art or using nail cosmetics. So shaping the nail is one thing, grooming the nail is next. After using the nail cosmetics, when you are removing it, keep 7 days gap from the reapplication. So between two applications, you have to keep 7 days gap. What happens when you use lot of nail cosmetics? From the nail plate, you can see some discoloration. From the nail matrix, actually the nail is growing. And if you are not giving enough time for the nail to grow properly, it will always be discolored. So you should give gap of at least 7 to 10 days before reapplication of next nail cosmetics. Then coming to nail conditions, which as a part of skin problem. Nail is just not the structure of the skin, but it also diagnoses and reveals your inner health and some general conditions that you are going through. You all might have seen, when somebody gets jaundice, their nails become yellow. When somebody is not eating properly, your nails show some changes. Very classically, if I have to say, when you have spoon shaped nail, it reveals that you have iron deficiency. When you have color change onto your nails, it reveals that either you are not eating properly, or you have certain autoimmune conditions, or you are taking certain medication which is causing discoloration of the nail plate. Very commonly we see infection on the nail. In that we see bacterial infection and fungal infection. I just mentioned the occlusion that happens because of wearing a tight fitting shoe or because of immersion of hands in the water, that affects the nail plate and it gives rise to fungal infection of the nail. This fungal infection is actually seen as the nail plate becomes thickened and you see sometimes that the whitish skin comes out from underneath the nail plate. So that is a fungal infection commonly. Then the bacterial infection. Bacterial infection comes around the nail or even in the nail bed, which is very painful. In and around area of the nail becomes red, there is pus and it is swollen. That is bacterial infection of the nail, we call it paronychia. Sometimes when you have some skin issues like extremely dry skin, we call it atopic dermatitis. Next common condition, psoriasis, wherein nail pitting is predominant. Some other conditions which are autoimmune like systemic lupus erythematosus, therein we see brittle nails. When you are getting diagnosed with some medical condition and you start taking medication for it for a long period of time, due to the ingestion of those drugs also you get some discoloration onto the nails. So nails are actually telling you how your health is keeping, how is your lifestyle. Sometimes you see black discoloration on the nail in a linear way. A lot of people come to me and ask whether it is a nail cancer. Melanoma is one condition wherein we see certain blackish streaks onto the nail, but not always that it is related to melanoma. Some trauma onto your nail can also give rise to discoloration onto your nail. In due course of time that goes off. And there is one more common thing that I come across, nail biting habit. A lot of people when they get stressed, they bite their nail. Sometimes they are not just biting their nail, they will also bite the skin around it. That is traumatizing for the nail and that can give rise to a lot of dryness around the nail, or they are again prone for nail infections. So consider nail as an important structure of your body because it reveals a lot of things that are going inside, from your inner health up to your stress level also. Thank you very much.